Hello everyone, my name is Zhiyong Yang. I'm pleased to have this opportunity to present our study on behalf of my team. Our study focuses on heterogeneous treatment effect of systemic corticosteroids in patients with pneumonia. I divided my presentation into 5 parts. Pneumonia is a leading cause of morbidity and mortality worldwide. It commonly affects older people and those with underlying medical conditions. In US, pneumonia is the most common cause of hospital admissions, and about 50,000 patients die from pneumonia every year. Corticosteroids may attenuate inflammation in pneumonia. However, efficacy of corticosteroids in preventing death in pneumonia have been inconsistent in clinical trials. Current guidelines does not recommend routine use of corticosteroids for pneumonia patients who require hospitalization. Our study was to examine whether the effectiveness of systemic corticosteroids for treating pneumonia could vary by patient characteristics. We conducted a retrospective cohort study using MIMIC-4 database from US. Adult patients first admitted to hospital with a diagnosis of pneumonia were included. Exposure of interest was systemic corticosteroids given orally or intravenously. We are looking at 2 clinically relevant outcomes in hospital mortality and mechanical ventilation. We included a variety of covariates in our analysis, which represent patient characteristics that may lead to heterogeneous treatment effect of systemic corticosteroids. Since our study was based on real-world observational data, there is likely potential confounding. To control for this, we used probability score matching. We then randomly divided the matched population to 2 subpopulations, one for splitting and the other for heterogeneous treatment effect estimation. We used only causal theories to identify heterogeneous subgroups. Finally, we included about 2002 patients with use of corticosteroids matched to the same number of patients with no use of corticosteroids. Before probability score matching, many baseline characteristics were not similar between 2 groups, as suggested by standardized mean difference of larger than 0.1 and a p-value of less than 0.05. However, after matching, baseline characteristics became similar between the 2 groups. For in-hospital mortality, we observed significant heterogeneity in effect of systemic corticosteroids against the ranking of estimated individual treatment effects. White blood cells, age, and creatinine were the top 3 important factors that would affect the effectiveness of systemic corticosteroids in preventing deaths. The figure on the right is the best causal tree, where we found 3 subgroups based on white blood cell and ICU stay may differ in the effectiveness of systemic corticosteroids. Similarly, for mechanical ventilation, we observed significant heterogeneity in the effects of systemic corticosteroids. Age, white blood cells, and creatinine were also the top 3 important factors. In the best causal tree, we found 5 subgroups based on white blood cells, age, pneumonia type, and COPD may differ in the effectiveness of systemic corticosteroids. To our best knowledge, our study was the first one based on the machine learning to explore heterogeneous treatment effect of systemic corticosteroids in treating pneumonia. We included a large sample size and accounted for confounding. Our study also had a limitation. We excluded patients with missing value, but they only accounted for 12%. We were not able to analyze some important characteristics that had a large number of missing values. Our study suggested the benefit of systemic corticosteroids likely depend on patient characteristics. Age, white blood cells, and creatinine may be the major influence factor that should be considered in clinical practice. We will continue our study to examine whether these initial findings can be generalized to other clinical settings. We will also focus on COVID-19 in patients when data were available in MIMIC-4. Thank you for your attention.